while experts are still learning the symptoms of the coronavirus strain, like loss of smell, dizziness, headache, some new symptoms came out this weekend. Some people say they were experiencing new, unusual symptoms such as painful skin rashes, even foot sores. Right now we have Dr. Anetta Reszko of Dermatology to break it down for us, to tell us more on what potential dangers we could be facing if not treated very well. So good morning to you, doctor. Thank you so much for joining us. Tell me first and foremost, when these skin conditions pop up, what do they look like here that you're hearing about? And are they most prevalent in coronavirus patients?
Good morning. Yes, over the past few days, several doctors have identified very specific skin rashes that are actually associated with COVID-19 infection. And those rashes that are specific for COVID can involve lace-like rashes, mostly on the extremities. Those rashes are red to violaceous looking. And the second specific finding is bluish to reddish discoloration of the toes, so-called COVID toes. Patients actually do complain of tenderness. Sometimes they have difficulty walking. Sometimes there is abnormal sensation in the toes. Toes almost look like if they had been bruised or frostbitten, but there
Right.
is really no history of trauma.
So are you seeing this in a specific age group? Because I was reading some articles about the COVID toe, and it seemed like it was really prevalent in young children. So what are you hearing about?
Right. So younger people are a little bit more susceptible to it. We do not know why that happens. But what's very important is actually that the presence of those skin manifestations can actually be associated with what's called hypercoagulable state. And basically what that means is formation of little blood clots inside the blood vessels. So this condition is almost a medical emergency. Your viewers and everybody who they know, if they develop those conditions, they should seek medical attention. They probably need to be admitted to the hospital, possibly hospitalized, at least monitored very closely.
So you're saying even if you have the COVID toe or a skin rash, but you have no other symptoms, you should still call your doctor and find out what's going on, because it could be an issue with blood clotting, which is a very serious symptom. It may not be coronavirus per se.
Well, it is coronavirus-associated clotting. So coronavirus is a very smart virus. It's a very difficult enemy to target because it does affect respiratory mucosa. It infects the lungs and the nasopharynx, but it also has impact on the whole body immune system. So it actually causes a cytokine storm, and that may in turn lead to this hypercoagulable state when people start forming blood clots. So that's the danger of the coronavirus. So patients who do develop the COVID toes should actually get screened, should seek medical attention.
Okay, got it. And are there any treatments that you should recommend to patients right now because of some of the skin rashes? I know this is very new and you're learning every single day.
I would just say, contact your doctor. People may have other underlying conditions. I would say don't treat yourself. Let your doctor decide what's the best course of action, what's the best treatment for you.
Yeah, because if not treated properly, tell me, I don't want to scare people, but I do want to give them the reality. What are some of the possible dangers that could occur if you don't get it treated properly?
So there are two types of blood clots that can develop. There can be blood clots in the veins and in the arteries. And, we all know what stroke looks like, when you have decreased oxygen and nutrient flow to different organ systems, including the skin, including brain, including the heart. That is potentially life-threatening situation. So patients do need to be evaluated. They need to be seen in the hospital and treated in the adequate way. They can
Understood.
potentially die if left untreated.
Understood. And doctors across the board, they know about this? I mean, is it something widespread out there, or is it something that doctors are still hearing about?
Oh, this is all brand new. We're learning so much about this coronavirus. Every single day, there is a ton of research done, published. We're learning so much. I don't think it is a common knowledge just yet. I'm so glad that you're talking about it on air,
Yeah.
that you're spreading the message, because it is one of the most important skin findings. It is something that, people sometimes may take for granted. They may feel that they traumatize the toes or so on. And it's very important for them to be aware that there are potential other clinical implications of those rashes. So thank you for spreading the word.
Oh, well, thank you for coming in and really raising awareness about this and sounding the alarm. We do appreciate your time, Dr. Anetta Reszko. Appreciate it, okay? Stay safe to you.
My pleasure, of course.